My name is Dr. Paul Davison. I'm a chiropractor in Coburg. I've been practicing for almost 2 years now. I'm a Coburg resident, and I've been at my current office for a year and a half. I'm not specialized in sports injuries, however, I have been introduced and experienced or exposed to sports injuries a lot through the years, and I have a very good knowledge of how the body works with regards to sports and sports-related injuries. I also have a family practice, so anyone from infants, my son's age over here, 4 months, to the elderly, 70s, 80s, 90s. Go ahead, slide. There we go. I just want to talk generally about chiropractic care. How many of you here have had chiropractic care before? Okay, and there are 3 of you that have not. My talk is geared towards the people that have not had chiropractic care. Maybe you have more questions about what it is, how it works. Some of you may be intimidated by a chiropractor. I'm just going to give some base knowledge. If you have any questions at all, please just ask. Okay, don't be afraid to interrupt me and ask a question. So, what is chiropractic care? Chiropractic focuses on disorders of the musculoskeletal system and the nervous system, and the effects of the general disorders on your health. Okay? Go ahead. That's pretty much what it's going to be like. I'll finish off the slide. Chiropractic was established in 1895 by a man named D.D. Palmer. He is actually originally from Port Perry, Ontario. He then moved with his brother to, I believe it is St. Louis. And that's where the chiropractic became more famous, was in the States. However, he is a Canadian. All Canadian provinces and territories officially recognize chiropractic as an independent healthcare profession. So, like your physiotherapists, like your medical doctors, the Ontario and Canadian Chiropractic Association have their own governing bodies. Chiropractic care is available to members of the armed forces and veterans. Chiropractic care is no longer covered by OHIP. It once was. I want to say about 10 years ago, however now it has not been. But most independent insurance companies do cover or give you an allotted amount of monies towards chiropractic care. Doctors of chiropractic provide care in hospitals and other multidisciplinary offices. For example, when I first came to Coburg, I started up in a physiotherapist's office. So we were linked with acupuncture, physiotherapy, and then of course we had chiropractic and now there's podiatry or chiropody. There's 2 different names for foot care. Okay? Often referred to as chiropractors or chiropractic physicians, we practice drug-free, hands-on approach to healthcare. So we do not write prescriptions, we don't give out drugs. We give nutritional information, we give exercises, and we do a hands-on approach. We undergo rigorous education. So, for example, a medical doctor, you would say, has the longest span of education there is out there. It's not true. Chiropractors, at least other professions, do have same education lengths, but chiropractors have the exact same time. We go for 4 years of undergraduate to a university, and then 4 years of professional school. Okay? So you're talking a minimum of 8 years of school, 4,200 hours of classroom, laboratory, and clinical experiences. Okay? We write provincial and national exams. I wrote my Ontario exam and my Canadian board exams. You have to pass in order to get in to practice in Ontario and Canada. So what do chiropractors, what do we treat? You think we're back doctors, right? We only do backs. That's not true. We do specialize in backs. However, we also deal with neck pain, pains in the joints, arms, legs, headaches, whiplash from motor vehicle accidents, and again, myself, sports injuries and work-related injuries, so WSIB case is what it's called. Research also supports chiropractic as a treatment method for conditions such as carpal tunnel, people that sit at a desk all day and have their wrists up against the computer, or the desk I should say, typing on a computer. Otitis media, that's an inner ear infection. Otitis means an inflammation of. What you can get is infections, you can get bacteria, you can get discomfort in the inner ear. A lot of the times infants will get it. And an adjustment has been shown, research has shown to help. Not always the case, but a lot of the time it does help. Colic is when a baby is having a difficult time going to the washroom. If you're crying a lot, if you're constipated, has been very good for that. And asthma. Good. Just some quotes here, just from research. Acute and chronic chiropractic patients experience better outcomes in pain, functional disability, and patient satisfaction than patients seen by other healthcare professionals. Okay, that was from the Journal of Manipulative and Physiological Therapeutics. Go ahead. And then a couple other ones here from some research. Patients with chronic low back pain treated by chiropractors showed greater improvement and satisfaction at 1 month than patients treated by family physicians. Okay, in 2000. And cervical spine manipulation, so adjusting the neck. I know a lot of people have a hard time with dealing with that. Was associated with significant improvements in headache outcomes in trials involving patients with neck pain and/or neck dysfunction and headache. So what that's a mouthful, I understand it. What that's trying to say is people with headaches and neck pain, those who went to see a chiropractor and had their neck adjusted and had muscle work done to their neck, had significant improvements within a lot of time period. So whatever the time period the trials were. But it's trying to say that patients had an excellent recovery rate. Okay? Go ahead. The most common therapeutic procedure performed by doctors of chiropractic is known as a spinal adjustment or a spinal manipulation. A chiropractic adjustment is what they call it. Okay? Go ahead. Sorry. The adjustment, what it is when you get your neck adjusted by a chiropractor, what do you think of? You think of a crack, right? You think of yeah, exactly, the snapping, the bone on bone. Trust me, if it was bone on bone, we wouldn't be in business. Okay? In 1895, in 1896, it would have gone extinct. Okay? It is not a bone on bone or a cracking of the bones. Okay? You know when you open a pop can for the first time, how it makes that psst sound? It's that release of pressure. That's exactly what an adjustment is. You gap the joints in your neck just enough that you're allowing gases to come out. And that's what creates that cracking sound. Okay? In addition to the adjustments that we do therapeutic ultrasound, electrical muscle stimulation, also called IFC, or interferential current, ice and heat, traction, soft tissue. For example, I'm a specialist at what's called active release technique. It's a very specialized and pinpoint accurate muscle technique that helps to alleviate pain and discomfort wherever it may be in the muscles. And then, of course, afterwards we'll give rehabilitative exercises to help recoup and recover. Go ahead. When you come to a chiropractor, usually what you do is you come for an initial consultation, okay? Because you need to give us a history. You can tell us what's going on, tell us why you're here, and then what we do is we step back, we evaluate, we do a physical examination of the area, of your area of complaint. We'll give you a diagnosis, okay? And then what we'll do is we'll come up with an appropriate treatment plan for your pain, discomfort, or your injury, okay? If your chiropractor determines that your condition would be more appropriately treated, by another healthcare professional, he or she will make the appropriate referral. For example, if you came in and you said, I've got some pain in here, I feel like it's my liver, I feel like it's my kidney, I feel like it's my lung. Chiropractors are not, we have to know, we're trained to know when we can and cannot treat these, or when we should refer out to another professional. So if you were to come into my office and say you had pain here and it feels like a kidney, I'm having difficulty going to the washroom, those signs would all lead to, I need to send this person out to the hospital, I need to send this person to the medical doctor, something of that nature. Okay? With chiropractic, when will I feel better? Many patients feel immediate relief following a chiropractic treatment. For others, it may take 2 or 3 weeks before they achieve substantial progress. For example, someone of 21 years of age may recover within 2, 3, 4 days of treatment. Somebody 70, 80, 90 years of age, their immune system and their body do not heal as well as somebody that's 21 or 20 years of age. So it may take a longer period of time. You can get the same goal, you can get pain-free, however, it may take longer for you versus someone younger. Your health status, your age, and level of activity also play a role. If you're getting injured, your shoulder being injured as a hockey player, for example, and you're going right back out and playing hockey again, right? You're getting body checked on the boards, you're taking wrist shots, slap shots, you're moving your shoulders. It's not helping the healing process, okay? The concept of wellness. Doctors of chiropractic believe prevention is the key to health and wellness. Okay? Preventative care. Yes, you get injuries. When you come in, we'll treat the injury, we'll get you back to a normal state. Okay? After that, it's recommended that you come in for regular visits. Not every week, not every couple weeks. Usually what it is a monthly regime, because, for example, you get your oil changed every 5,000 kilometers, correct? To keep your engine healthy, to keep your car running. Same thing applies for your body. Okay? Your engine is this, it needs to stay healthy, it needs to stay clean. That's what preventative care is. Okay? Other tips to help stay well: exercise regularly, eat well, maintain a healthy weight, exercise, reduce your stress, that's a big one. Avoid smoking, get regular health checkups. That's that preventative maintenance I was talking about. Doctors of chiropractic care are trained to recommend therapeutic and rehabilitative exercises, as well as provide nutritional, dietary, and life counseling. Okay? Go ahead. Is chiropractic treatment appropriate for children? Yes. Children can benefit from chiropractic care. Previous slides I had mentioned colic and otitis media, something that happens very frequently in infants and young children. Children are very physically active. They're learning, they're running around, they're bumping into things, they're getting injuries here and there, and are experiencing many types of falls and injuries. Chiropractic manipulation is very gentle and safe for infants and young kids. Okay? I have personal experience working on young infants as young as 4 months and into their 6, 7, 8, 9 years of age. Okay? I have seen firsthand the benefits of chiropractic care. Will it work every single time? No, it probably won't. That's the reality of it. However, it is worth a try to see if chiropractic care can help the condition you have. Again, if you come in and we have a consultation and it's determined that you'd be better off to see another healthcare professional, that will be determined then. But it's worth a try. It's in infants and elderly and all in between. Okay? Too fast. No, that's okay. That's okay. And then there's the seniors. They're senior citizens in chiropractic. For older patients, many of their ailments are related to the spine and extremities. Okay? Conditions associated with aging may benefit from corrective adjustments. If adjustments are not the way to go, muscle care. Okay? Because muscles are like guide wires to your bones. If they're pulling harder one way versus the other, it's going to pull your bones one way versus another. It's going to impede on proper flow of your muscular system, your circulatory system, and your nervous system. Arthritis, circulatory disorders, joint stiffness and pain are common ailments that elderly have. Okay? And then again, I know that for some senior citizens, it's difficult to get up, it's difficult to move, it's difficult financially. Most private insurance companies cover chiropractic services for at least $500. Okay? Green Shield, Sun Life, there's other kind of insurance companies out there that have chiropractic care. And if you're in a home, a lot of times what happens is a nursing home will help with chiropractic care. They'll have them come in if need be, and the chiropractor will provide services for the nursing home. Are there side effects? Of course there are. There's side effects to anything that we do. Okay? A very conservative, drug-free surgery approach to reducing pain and improving mobility. That's what we do. The side effects to that, while any form of health treatment contains a degree of inherent risk, there are a few side effects to chiropractic. The most common side effect following treatment is mild soreness, similar to exercise. I'll talk on that in a minute. That may last for 12 to 48 hours. What that's trying to say is, just like you go to the gym and go for a workout, or you go to the garden and you're active, you get some tenderness and some soreness afterwards. Correct? The same thing happens similarly to chiropractic care. When you come in and you get the muscles worked on, you're working on the muscles the way they haven't been when there's an injury. Therefore, recovery, when you recover 12 to 48 hours later, can have some discomfort, soreness, tenderness. How many Canadians see chiropractic care? More than 11 million people visited doctors of chiropractic care last year for a variety of conditions. More and more medical doctors are referring their patients to doctors of chiropractic. Back in the day, chiropractors and medical doctors didn't get along. Our medical doctors did not like chiropractors, didn't believe in what we did. Okay? The attitude has changed significantly. Okay? Nowadays, new school chiropractors or the new taught chiropractors are much more apt to send their patients to chiropractors for something that drugs just don't need to be. Okay? If they don't need a prescription for something, send their patients to a chiropractor and see if we can help with the ailments. Okay? The communication and the relationship between us is getting much, much better even as the years progress. Okay? Why our record number of Canadians seeing chiropractic care? Because it works. Okay? Does anybody have any questions, comments, concerns, anything I can talk about?
Are there any patients you wouldn't normally work on because of age or disease or any limitations like that? Or pretty much
Yes.
You can do anything.
You can
do anything.
Yeah, no, we can't do anything. There are limitations. For example, a hockey player walks in and has a fractured arm. Comes in and says, you know what, I don't know if it's fractured or not. There are certain tests we can do. They're not 100% accurate, but they give you an 80-85% accuracy rating as to say, okay, you know what, I'm still unsure, or yes, you do have it. Go to the hospital, get an x-ray done, or go to the medical doctor and have it further looked at with blood work, any kind of imaging, something of that nature. So yes, there are limitations. However, we are a primary care giver. So if you have something the matter or you need something like that, you can come to us right away, and we are very well trained to either treat appropriately or refer appropriately. Go ahead.
So I'll give you an example. Like,
Go for it.
So I tore my ACL.
Yep.
And from what I saw on your screen, you do something very similar to what a physiotherapist would do.
Exactly.
You have a treatment, you have exercises, you have a whole plan.
Yep.
So what would be the differences between yourself and a physiotherapist? What would be the benefits? What would be, what are the plus and minuses to go to a chiropractor?
The benefits are, okay, and of course you're coming with my opinion, right? I'm a chiropractor, physios. I used to work under physios, I would say I work with physios. They're very, very similar. However, we have longer education, we have more education. We are trained more specifically to give adjustments because that is our claim, our prescription, if you will. That's what we do. However, we are also trained throughout those 4 years of professional doctor school to give the exercises, to give the adjustments, to give the hands-on technique that we need to. Getting more specifically to your answer, in my opinion, physiotherapists are good at what they do, but they give you some exercises and then they walk away and they go with somebody else and they let you do exercises up against the wall, trained sometimes or supervised, and then also unsupervised. Whereas chiropractors see you for a half hour. Every minute of that half hour, you are being watched, you're being taught, you're being trained. The doctor-patient relationship there is on 110%. Okay? So, in a nutshell, it's in your opinion. It's whatever you feel is necessary to your needs. That's why I'm trying to say, chiropractors don't just do backs. We do knees, we do shoulders, we do ACL repairs, recovery I should say, MCLs, meniscus, you name it, we do it. It's just a matter of getting the word out to people that chiropractors can do it too, and we are not just back specialists. We are full body specialists, musculoskeletal. Okay? Did I answer your question?
Yeah, definitely.
Okay. I saw another hand come up here. Go ahead.
I have a relative in Toronto,
Okay.
and she's expecting, and all of a sudden she got a sore neck
Okay.
and headaches.
Mm-hmm.
So she went to her doctor, and he didn't want to put her on antibiotics, just Tylenol.
Yes, because of the baby.
And, yes.
Mm-hmm.
And her mother gave her Dr. Ho's H.O.
Yep, I know what you're talking about. It's an electrical stimulation.
Yeah.
Yep.
For her neck to help
Okay.
her.
Yes. So what's your question? Are you telling me or are you asking?
Well, I'm telling you where she's at.
Okay.
Would you be able to help in any way if she came to you, if someone like that came to you?
Yes. I have treated pregnant
But
women
she
before.
doesn't know.
I have treated pregnant women before. A lot of the times what happens with pregnant ladies is it's the hormone imbalance, or the hormones are going all over the place. That's what leads to headaches. What we can do is muscles will be affected by that, okay? And muscles attach from the back of your spine all the way. In a perfect world, a muscle would line your back here, a muscle would line your back here, and then here. But that's not a perfect world, is it? They're intertwined, they interlace, they overlap, okay? And as such, when one's affected, usually it grabs onto 2 or 3 others in the area. When they attach to the back of your head, and they get tight, and they get ticked off in a sense, they grab onto the back of your head. That's what helps deal with the headaches, tension headaches. Okay, you have muscles around your skull as well that create the tension headaches. Okay, we can give adjustments, have been shown to be very effective for headaches and neck pain.
Grab the head.
Yes, it is. That's how you do it. Again, it's not one of those Steven Seagal spin your head around and exorcist things. It's an appropriate, controlled adjustment. Okay, that's what I'm trying to say. We've gone to school for 4 years. I've been trained in this for 4 years, and if it wasn't successful, again, in 1896, it would have been cut loose. Okay, I have treated pregnant ladies before. I've had a lot of success with them. I do use the electrical stimulation that you're talking about. It's not Dr. Hose. This is called interferential current. Okay, it's an industrial size almost. Okay. But you put it in appropriate places to help facilitate the muscles, and what it does, it helps take away the pain as well, it relaxes things. Okay? So yes, I don't know, I can't say for sure that I would help her, but she can come and you can essentially give it a try.
So I'll recommend her to go to the chiropractor.
Absolutely. If she can benefit from it, then absolutely, I would recommend that in a heartbeat. Anything you can do to help that is healthy and safe, absolutely. Absolutely, and again, chiropractic has been very effective for pregnant women.
She's in pain.
And I don't doubt it. I have seen the full gamut. I've seen people coming in for more maintenance type stuff, and I've seen people coming in that could barely stand up. They're coming in on a 45 or 90-degree angle, and I've had to try to get them back up right again. And again, with a lot of success. Okay.
Sorry.
Yeah. Okay.
You say your practice involves musculoskeletal.
Yes.
Where does the nervous system fit in?
The nervous system is the brain.
I understand, but in terms of pain,
The pain is facilitated.
somebody will come to you
Yes.
that I have pain in the back or shoulder or whatever.
Yes.
And the pain, it could be muscle spasm, it could be dislocation, or any of those things.
Yes.
And the pain is ultimately transmitted from there to the brain, and
Yes.
so that's what the pain is.
That's right.
So now, does the nervous system hurt per se by itself? Because often we go and the surgeon says, oh, you have a herniated disc,
Right.
which may not be true at all.
That's right.
Most often it's spasm muscles, and that's concerned.
Yes.
So what does the patient do here?
The patient needs to get proper consultation. So the patient that has the pain, for example, a herniated disc or back pain, they need to come and you need to do appropriate orthopedic tests. We do have orthopedic tests out there that will focus on disc herniations. For example, there's a maneuver called Valsalva's maneuver, where you increase the pressure inside your spine. Essentially, it's like going to the washroom, number 2. You increase the pressure. The increased pressure puts pressure on what would be the discs. And if you had a disc herniation, you would have increased symptoms into your leg, okay? Because it pushes on the nerve. The disc bulge pushes on the nerve, and there's where your neurological system comes into play. The bulge will push on the nerve, sending the symptoms down the leg, and as a result, you get the pain. Another way of saying it is when you get an adjustment from the chiropractor, what happens is the bones are out of place, and if you look at a model of the spine, the nerves come out, the foramens, the little holes at the sides, and they move along your body to innervate the muscles. When the bones are pinched on the nerve, that's what can cause the shearing pain, the numbness, the tingling into the hands, into the fingers. And as a result, you would give an adjustment to reset the muscles and reset the bones, which would allow proper flow of the nervous system. Okay? Did I answer your question?
Yeah,
Relatively?
no, it's not an answer I'm looking for. I'm saying from the physiological point of view, the two are intimately connected.
Yes, I would agree.
There is very little chance that the nerves are out of place by themselves.
That's
The
right.
nerves are only transmitters,
You got it.
right?
Yep.
So, for example, I was frozen shoulder. So the doctor says here are the two options. Either you take cortisone and then we'll do some stretching,
Yep.
or I'll send you to a chiropractor or a physiotherapist.
That's right.
The physiotherapist says, here's what I'm going to do, and it's going to hurt. And I'm going to tear some of your muscles
Right.
and here are the exercises.
Right.
Once I learned what it was, then with those exercises, I was not able to raise my hand above here.
Right.
I couldn't wear a shirt or a jacket or drive.
Putting a coat on is difficult.
It was impossible.
Exactly.
It took 7 months. But then I just told my wife to just keep pushing until I scream. Because if it's going to pain, I'm going to bear the pain.
That's right.
Open up because some muscle fibers, as
Yep.
you grow older, are going to shrink.
That's right.
And
Absolutely.
so that tearing. But some people can't take the pain,
That's
so
right.
they rather take cortisone.
That's
Now,
right.
that's going to complicate matters.
Exactly. No, that's a great example. It really is. You can go the non-pain route or the easier route, or you can do the no pain, no gain kind of thing. And as you were saying, doctor, it's a matter of tearing the muscles to repair the muscles. And the nervous system is obviously innervating the muscles to allow them to move. So as a result of tearing the muscles, you're going to get the pain signal coming back through the nerves to the brain. So yes, it's an excellent point. It's an excellent example.
Because that concentration was very good. He told me it's going to hurt.
Yes. Yep. Frozen shoulder is exactly what it sounds like. It's a frozen
And
shoulder.
I screamed, and so I knew that's what it was.
That's right. But you're a lot better now.
Yeah. Oh yeah, absolutely. This is that 7 years ago.
Yeah. Yep. And there's the appropriate time frame that it takes to get better. Did I answer everyone's questions? Perfect. All right. Thank you very much.
Thank you.
Thank you.